The balance between GABA and glutamate can be disturbed by several factors, such as the use of drugs or alcohol, sugar, cereals, starchy food, caffeine, chocolate, benzodiazepines, insufficient serotonin, artificial sweeteners, nicotine, food additives, dyes and flavors, and excess calcium. In addition, high levels of glutamate lead to a decrease in glutathione levels, which is critical for inflammation control, intestinal health and detoxification. In particular, it also increases the level of eosinophils, groups of white blood cells that cause inflammation and mercury toxicity, which may be present in the body and may contribute to the growth of cancer cells and tumors. It can be very problematic for anyone who has problems with excess glutamate, which may be a problem for people with sugar and carbohydrate addiction, anxiety and panic disorder, and excessive growth of candidiasis, OCD, autism spectrum disorders, migraine, hyperactivity, ALS, Parkinson's, Tourette's, PANDAS, convulsions, multiple sclerosis, fibromyalgia, multiple chemical sensitivity, insomnia, chronic fatigue, SIBO and others are common. If this is the case, they will always tend to have too high a content of glutamate, and throughout their lives they will have to kill substances that further increase glutamate levels, such as bone broth. The activation of the sympathetic nervous system, also known as stress response, also produces a number of negative effects, such as weakened immunity, impaired production of gastric acid and digestive enzymes, inhibition of digestion and absorption of nutrients, serotonin suppression, increased blood sugar levels, destruction of healthy intestinal bacteria, inhibition of the motor transmission complex, and more. If your only problem with bone structure is a high content of glutamate, not histamine, it may work. However, it does not affect the problem with histamines. Therefore, people with problems with high levels of histamine can sometimes reduce their level to such an extent that they can comfortably eat foods such as bone broth, but they cannot. However, it is important to know that bone broth has a very high level of free glutamate, which can increase the level of glutamate. Therefore, in some cases, the level of glutamate may drop sufficiently to take advantage of bone broth, but usually it is not. I disagree with this attitude. The most likely cause of negative symptoms is a problem with histamine, glutamate or SIBO, and continued use will cause serious problems. It has been consumed by our ancestors for millions of years and is very popular in the Paleozoic community and many other nutritional philosophies, because it will help to heal and seal the intestines, prevent inflammation, promote healthy digestion, maintain the immune system, suppress microbial infections, reduce joint pain and inflammation, promote strong and healthy growth of bones, hair and nails, and develop a more balanced nervous system. Excess histamine can also be caused by a number of factors, including excess histamine-producing bacteria in the gastrointestinal tract, excess candidiasis, nutritional deficiencies, altered methylation, nutritional sensitivity, lack of GABA-MNT enzymes needed to decompose it, and genetic polymorphism. Studies show that higher levels of intelligence and superior learning and memory performance are directly related to higher levels of glutamate receptors, as well as seizures and increased risk of stroke, as excess glutamate is toxic to the brain.